We've got Professor Dr. Pratit Samdani, who's an internal physician, as well as Dhrubabrata Ghosh, Managing Director, Data and Analytics at Protiviti India. Thank you so much for taking time out and joining in. I'm going to bring you in first, Professor Samdani, to talk about the kind of trends that we're seeing. It seems like good news from what my colleague was talking about, by COVID potentially peaking by the beginning of September, and the end date is still far away, which is the 3rd of December, as per the projections of this report. Would you largely concur with these findings and walk us through the rationale?
So I think they've done a great analysis. And please remember, this is a disease. It's a pandemic. It's not a train that's going to take you from station A to station B. So there can't be a correct or a fixed or an absolute targeted date. But more or less, seeing what I see on ground reality is that Mumbai, although the cases are rising in the country, is kind of not skyrocketing now. I think it's nearing its peak, and it would peak in the next couple of weeks, 2 to 3 weeks. And then please remember, the meaning of peak and flattening is different. Peaking is when you have a surge, you hit a high, and then you flatten. Flattening does not mean 0 cases. Flattening means no rise in number of cases. When I talk to most people, they say, oh, wow, so if you are at 50,000, we'll come down to 1,000. That's not flattening. That's a decline. So I think the truth remains that we probably are peaking, and that's great news. So as we start peaking in the next couple of weeks, September mid or September end, I think we'll see a nice decline towards the end of December. So that is true.
Okay, fair enough. Moving on then, and wanted to get in a word from you then, Mr. Ghosh. From the 1st of June, the migrant workers started to move within states, and the cases stood at about 2 lakh. However, post that, we have seen a substantial rise in cases by nearly 3 times within just the first month in July, and the cases rose nearly 13 times then by the month of August, as of course we are seeing more relaxations and things starting to improve. What have been the key findings in the report?
So if you look from what happened since 1st of June, you would see definitely the number of confirmed cases going up. But more than the confirmed case, what we should worry about is the net new additions which happens. So during the first week of June, first week of July, we were adding roughly around 7,000-8,000 cases a day. When I say adding, it's the number of confirmed cases minus the number of recovered cases. But as we move to August, that became somewhere around 16,000 odd cases. Now, if you look at 15th of August timeframe, we have come down from that particular number. We are roughly around 8,000 cases to 7,000 net new additions, which is happening on a day-to-day basis. So yes, there was a peak, and there still continues to be around 65,000 cases per day, but the net new cases have started to come down. And as the professor said, a lot of these things was skyrocketing, and most of the states seem to be having it under control. When I say under control, I mean it could have potentially skyrocketed much more. If you look at the eastern states, it could have actually shown the similar trend which we saw in the southern states, which did not happen. Pune, Thane, they were growing pretty rapidly. That also came to a kind of a check. So we are not seeing that 3,000 becoming 8,000 or 10,000 cases, which we see in Andhra or Bangalore. So we have been able to put a little bit of check on the rise on the number of confirmed cases as well. And as you rightly mentioned, the rate at which the confirmed cases are growing is much slower than the rate at which the recovery cases are growing. And hence, we expect to peak in the next 2 to 3 weeks. And as we all understand that it's going to be a flattening or a plateau for a considerable amount of time till it actually starts to come down.
Okay. Professor Samdani, when we're looking at 3rd December, as per the report, you were saying towards the end of December, is it normal to resume work? Because a vaccine may not get to everyone, let's say, even until early next year. How do you see behavior patterns then changing by the end of the year?
So as we start, as the offices start reopening, we're already seeing a lot number of people getting back to work. And, getting back to work is important. It's imperative for many people. There is a method when you start getting back to work. So there is a protocol that one must follow. We can't be lenient. We can't be casual. Our behavioral attitudes should be absolutely on our heads. We cannot be lax just because we've had COVID in the past or the numbers are coming down. This is an infectious disease. It has an R value of 2.5. That means one infected person can infect up to 2.5 to 3 other normal people. So it's highly infectious. We must be wearing a mask the moment we step out of home. We must, when we get into office, we must maintain a physical distance. I again say it's physical, not a social distance, to keep the sanity of the mind intact. We must make sure that we use our own table, use our own desk. If we do have flu or flu-like symptoms, it may not necessarily be COVID. We must stay back at home. We must volunteer and stay back at home and not put others at risk and ourselves at further risk by getting back to work. Also, a decorum in office should be maintained, especially places where there are a large number of employees. So the other big problem that I see may happen is canteen and foods and food places in offices. So the offices need to have a management protocol so that X number of people go in, they have a complete physical distance. Please wash your hands when you're in an office, clean your tabletops, clean your laptops, clean your phones at least once or twice a day. Do not cough into the face of someone else or in your hand. When we cough and sneeze, we've been taught from school to say, excuse me, please. I've been telling everyone, when you cough and sneeze, say elbow, please. So use your elbow to just reduce the transmission risk. So getting back to office would soon happen in larger numbers. But I think we must be careful and not fearful and continue maintaining the things that I've just said.
Mr. Ghosh, what about the implications for a city like Mumbai, which has been severely impacted because of the density, and it's a city with over 2.2 lakh cases, contributing nearly 15% to India's GDP. Recovery in states and cities like Mumbai, Pune, Thane, is that going to be slower? And also, are we well beyond any risk of a second wave?
Oh, you've got a smart question there. So if you saw the growth rate of Mumbai in the last week, it was about 0.8%, and it's increased a bit to 0.84 in this week. But that's a really small increase. The doubling time is about 90 days for Mumbai at the moment, and it's come a little bit down to 83 days. So what I'm trying to give you by this figure is, as we start opening, there may be a risk of further increase in number of cases. I wouldn't want to call it a second wave at this moment, but there will be increase in number of cases. And I'd really be careful, especially when our local trains, that's the lifeline of Mumbai, opens. When anywhere there's a large number of people who flock, half of them hanging out of trains, that's going to be a danger point, because there's no question of maintaining any form of physical distance, not 6 feet or 1 or 2 meters, and then not even 6 centimeters between two people. So that's the time that we have to be much more careful. The Mumbaikars should be ready to behave themselves when they get to office and they use public transport. When I say behave, it means the etiquettes of washing hands, keeping a distance, wearing your mask, don't spit around, do not chew tobacco, which warrants you to spit around, don't touch your face, avoid touching your face and mouth as far as possible. Clean your hands again. So I do expect or foresee a slight surge of cases when offices unlock completely and employees get back to work. So we'll have to be careful then.
Right. And add to that, if you look at Bombay right now, I would look at the total number of active cases, which is well below 20,000. I think it's somewhere around 17 or 18,000 odd cases. So that actually have an impact when you open up, because I wouldn't consider people who have already fallen sick and got better, right? So Bombay, Pune, Thane, they have, looking at the active number of cases, definitely they have gone down considerably. And as Professor Samdani rightly said, that we should be careful and cautious. We should not end up being what happened in Bangalore, right? When economic activity resumed without much precautions, maybe, and that kind of flared up the number of cases in Bangalore. We should be cautious, and I think this disease is not going to go away. There will be cases and people will keep on getting recovered till perhaps we get a vaccine. But yes, the number of cases should become manageable and will go down extensively as we move forward in the coming months.
Yes, I agree with you, Mr. Ghosh. And actually, if you see the numbers, just by the sheer number of India, let's compare USA, Brazil, India, and Italy. And I take Italy because it gave us lots of clue and management possibilities and opened the eyes of the world, because that was one of the first areas that it was peaking and at high numbers. So if you see USA, it's about 5.7 million cases. India is about 3. Brazil is 3.5. I think you're surely going to beat Brazil soon, unfortunately. Italy just had 2.5 lakh patients. Where in USA, there are about 15,000 new patients. India is going to about 69,000 new patients. And Italy has just improved itself to about only 100, 150 new patients. The death rate, USA 177,000, India is about 55,000 only. Brazil is 112,000 and Italy was 35,000. 35,000 on 2.5 lakhs is huge. The percentage is large. So India has fared better in terms of mortality and morbidity. The problem happens that if you see the percentage of deaths per million, it's very, very low in India. And that's a problem when I say because our population is large. Also, we've conducted lesser tests compared to the other countries. So we've just conducted about 23,000 cases per million compared to USA, which has conducted about 225,000 cases per million, and Italy 1.3 cases per million. So when we have larger number of cases, a larger number of testing facilities, and now the government is open for anyone to go and self-test it, we will find larger number of positive patients. But I think they can be well managed rather than just saying that, let's not only go on numbers, let's go on the effect and morbidity and mortality it also has. Because it's a virus, it's here to stay, it's not got an end date.
Right.
Right, so basically not letting your guard down, that continues to remain the underlying message. Mr. Ghosh, just to take forward the conversation with respect to what we're seeing across different states, Karnataka and Andhra Pradesh too have been quite severely hit after Maharashtra. We've got a massive number of cases that have been recorded there, over 90,000 in each of these states. What is the trend in terms of recovery that we're seeing here in down south?
I would say Andhra Pradesh is also kind of hit the peak. It's going down. It's still registered a huge number of cases. But I would say that it has not kind of thrown it out of proportion. So over the coming days, we will start seeing a decline in the number of cases in Andhra Pradesh. At least that's what the trend suggests. And if you look at Bangalore or Karnataka as such, we also expect in a couple of weeks, it's kind of peaking up, flattening for a certain time, and then start to come down. If you look at Tamil Nadu, or the other southern state, it is kind of flattened for quite a few weeks now. And as time progresses and as the number of confirmed cases starts coming down, we also see it declining gradually downwards. So the southern states, yes, it's still growing, but it's kind of reaching its peak or already crossed its peak and start to come down. So I would worry, but not to that extent.
Okay, fair enough. And Mr. Samdani, what would be your, outlook and assessment as to, when you think that we could perhaps lead to, the opening of trains, etc., as my colleague was talking about, just further relaxation down south as well, based the kind of number of cases that have been recorded?
So this could be based on two methods of thinking by the government and the municipality. One is when you have very few means relatively less numbers, so a plateauing or a decline. That's the time when they could think of reopening trains. Two, when you get a vaccine. I don't see a vaccine anywhere close in sight. It's not far away, but certainly not close. So my real view would honestly be probably 2021 rather than October or December of 2020. That would be my guess to open up trains, because opening up trains is gone. As you said, will it give us a second surge? Yes, there's a high chance if you just open up the trains completely. The festival seasons are also around, so there'll be more people going out, shopping for whatever reasons. So we need to be more careful for the next 3 months.
Thank you so much, gentlemen, for sharing with us your outlook and what people need to really be conscious of, as well as how you see trends shaping up across the country. Good to have you both on board.